I am a registered nurse here at Sullivan County Community Hospital, and I am the Director of Education. Today, I want to thank Mrs. Wright for allowing me the privilege to talk to you students about a career in the field of nursing. There are so many opportunities that you can utilize a nursing degree. You can use it in the hospital setting like I have. You can work in a nursing home. You can work in a rehab. You may use it as a school nurse, clinic nurse, community health and wellness nurse. There's so many options in different fields that you could be interested in. And in the hospital setting alone, you can be a med-surg nurse, a surgery nurse, an outpatient nurse, an OB nurse, and the list goes on and on. So whatever your passion is, whatever age group of patients you like to care for, you can definitely have a career in that area, and you can even specialize. So to talk a little bit about my past history, when I was in high school, I knew I wanted to be a nurse. So I went to the local nursing home at Millers Mary Manor, and I took the Certified Nurse's Aide course. I worked at Millers Mary Manor for several years, and I worked as a nurse's aide while I was in college. I went to Lincoln Trail College in Robinson, Illinois. They have the one-on-one program where you go the first year and you can take your boards for an LPN, a licensed practical nurse, and then you're automatically enrolled in the next year for the registered nurse. So after I got my LPN, 9 months later, I received my RN. And the great thing is that you can also specialize. As I told you, the emergency room is where I worked. I worked 12-hour shifts. And when you come in, you never know what you're going to see that day. You take care of all different age groups of people with any kind of injury or illness. And so you have to keep up on your education. You have to stay calm and be prepared to provide care for anything. And so every day is different. You don't see the same thing twice usually. And you get to be there for people in their time of need. And that was very appealing to me. And the great thing about working here at the hospital is that as I grew in my career and in my education, I was able to change roles. And so even though I'm the Director of Education, if we have a code blue, when there's a patient emergency or they get busy in the ER, I can go down and help provide care and then come back into my office and work on educational tasks. As the education director, I provide advanced cardiac life support, basic life support, pediatric advanced life support, classes and certifications for all our doctors, nurses, respiratory therapists, lab technicians. And I also teach for the community. Some of you might remember me from a CPR class for your health class in junior high or high school. We like to do a lot of community events and teach people how to control bleeding and stop the bleed classes, and how to provide CPR for someone in cardiac arrest. So I get a lot of the best of both worlds, get to do hands-on with patient care and get to provide education for staff in the community. So I am very happy in my job. I did later on go and get my bachelor's degree in nursing through University of Southern Indiana while I worked full-time here at the hospital. I've actually worked here 24 years, and I learned something new every day. And then most recently, since I've been a lifelong student, is I received 2 years ago my master's degree in nursing education. And so I encourage you, if you get your nursing degree, to at least get the base of an associate degree and keep building on that. You definitely want to have a bachelor's degree because they're pushing for BSNs at the bedside, which is the bachelor's nursing degree. And there's so many opportunities for you in the community, in the schools, just whatever your passion is. It is a well-paying job also. If you're going to put the time and effort in college, you want to be able to, support your family with where you're working. But I definitely feel nursing for me is a calling. It's a passion. And so if you ever have questions or have an interest in nursing that you want to reach out to me here at the hospital, you can most definitely call, and my extension is 2334. I'd be happy to share information with you. So I hope this lets you know that if you're interested in nursing, it is a wide open array of choices for you. And I hope you have a great day.